My name is David Adams. I'm the chairman of Cardiothoracic Surgery at Mount Sinai Hospital in New York. I've been in practice since 1992, so that's over 20 years, and I perform around 300 operations a year, which means I've done somewhere between 5,000 and 6,000 operations. And right now, 90% of my practice are valve related.
Hi everybody, it's Adam with HeartValveSurgery.com. Very happy to be here with Dr. David Adams. And Dr. Adams, maybe you could share with us what attracted you to cardiac surgery?
I always wanted to be a doctor. My dad was a doctor. He died when I was very young. I'm sure that impacted me. When I went to medical school, I loved cardiovascular physiology. And I always remember the first time I saw a heart operation at Duke and I saw all of the people that were involved. I called my mom that day and I said, that's what I want to do.
Dr. Adams, is there a particular type of valve therapy that you specialize in?
So I specialize in mitral valve reconstruction. So as opposed to valve replacement, I spent most of my career now working on therapies that allow patients to keep their own valves that aren't working correctly.
So Dr. Adams, if I'm a patient, I'm considering mitral valve repair surgery, what would you say are your top 3 best pieces of advice?
I think the first thing you have to know is what your indication for surgery is. So we spend a lot of time with patients making sure that they understand why they're being referred for surgery. And the reason that's important, Adam, is because many patients don't have any symptoms. So this is a disease where you may have an indication for surgery, but you don't feel anything yet. So it's very important that you have a thorough understanding why you're actually undergoing surgery. The second thing you have to know is who's your surgeon. You really want to keep your own valve, and depending on the complexity of your anatomy, then you may need an experienced, excellent cardiac surgeon doesn't do a lot of mitral valve surgery, or you may need someone that does nothing with mitral valve surgery. So it's really important that you understand what your valve condition is and what your likelihood of valve repair is. And the last thing you need to know about what are the outcomes in that hospital.
What are typical outcomes for mitral valve repair patients?
I think the issue is, Adam, is not on the day of surgery. That's important, but also it's important what happens to you 5 and 10 years later. And I think this is where valve reconstruction versus valve replacement really wins. Patients will live longer if they have a valve repair versus valve replacement. And I do think there is an issue here, teamwork. Doing an operation once a month versus doing an operation twice a week is very different in terms of how the rest of the team is working around the patient. So volume is important. It's not the only thing, but I think that the main message for patients is it's safe. The day of surgery, the week after surgery, your best chances of living a normal, event-free life is by having your valve repaired as opposed to replaced.